The thing that ruins most hip arthroscopy recoveries has nothing to do with the surgeon's skill. It almost also has nothing to do with how well the repair was done. I have performed this surgery hundreds of times, and I've watched how recovery goes across years of follow up, across thousands of patients. And there's a very clear pattern to me in who does well and who doesn't do well. But here's the part that I probably don't say often enough. I have been the patient. I've had hip arthroscopy, and I made exactly the mistake that I tell everyone not to make. And what happened after that is the most important thing that I now know about this recovery. And so in this video, I'm going to walk you through what's actually going wrong biologically in your hip when your recovery stalls, what most patients do in rehab that keeps them stuck, and also my own story and what you can do right now to protect your outcome after surgery. So point number one, biology does not follow your schedule. Let me start with what's actually happening inside your hip after hip arthroscopy. Hip arthroscopy is minimally invasive. The incisions are small. Patients see that and then they assume their recovery is going to be quick. But the size of the incision doesn't determine how long recovery takes. The tissue that we repaired inside and the bone reshaping that we've done is what dictates that. So when we repair the labrum, we're reattaching the cartilage, the entry cartilage to the socket back to the bone. That repair then goes through phases of healing. Early on, it's a little bit fragile, despite what could be a very robust repair. After the repair, over weeks and months, it gradually matures and then gains ultimate strength. But it doesn't follow your schedule. It follows biology. And biology doesn't really care how motivated you are or how good you feel at week 3. It just has to take some time. Then there's the hip capsule. That's that thick tissue we are working through to access your joint. That also has to heal. And your hip flexor tendon, which runs directly in front of your hip, your glutes that are the engine to the hip, all these take a little bit of time to settle down after surgery and to reach maximum strength. Most patients don't even know that their hip flexor is involved in a recovery. Some people aren't even aware of the muscles that they had to use in order to regain normal function back to their hip. But it almost always is important to get the strength to the muscles back, or to get even stronger than what you came into with surgery. And that's one of the main reasons that you may still feel discomfort. You may still feel that sharp pinch to your hip flexor, or even catching several weeks after you thought you'd be done with this. Early in my practice, I thought that if surgery was clean, recovery should be smooth and predictable. The hard part, I figured, was just the procedure itself. Then I watched thousands of my patients go through this, and I went through it myself. That belief completely changed thereafter. Here's the thing. Recovery after hip scope isn't passive. It's demanding, and it's longer than some people expect. And it's extremely sensitive to what you do and what you skip in the weeks and even months, both leading to surgery and after you leave the operating room. Think of it this way. The surgery sets the stage. Recovery is where the outcome gets decided. Point number 2, the rehab mistakes that keep people stuck. The most common reason recovery stalls isn't because the surgery failed. It's the rehab that's being done in a way that probably is keeping the hip irritated. And when I say wrong rehab, I don't mean that the patient is doing nothing. I also don't mean that they're seeing a lousy physical therapist. What I mean is they're doing things that seem reasonable at the time, but are actually working against healing. And here's what I see consistently. The first problem is exercises that are too aggressive for where you are after surgery. For example, clamshells and certain open chain movements such as straight leg raises, where the leg is floating around without ground contact, get prescribed a little bit too early because they're standard hip exercises for people who aren't injured or for people who haven't had surgery. But early in hip arthroscopy recovery, these movements are putting direct stress on the repair labrum and can aggravate the cartilage, cause shear, and may even aggravate the hip flexor tendon and cause excessive femoral head sliding. Some patients will do these religiously, but then the hip stays irritated, and then they come back telling you that nothing's working. Therefore, the program itself was the problem, rather than the surgery itself. Here's the second problem. Aggressive stretching at the wrong time. Pulling on the hip capsule before it's healed creates the kind of mechanical stress that the repair can't handle yet. It feels productive, but it's not. The third problem is the expectation gap. Patients come in expecting to feel normal in a few weeks. And when they don't, they start assuming that something went wrong structurally, that something is still torn, or that something is retorn, that surgery didn't work. But in most cases, when symptoms stick around at 6 weeks, 3 months, 4 months even, the issue isn't always structural damage. It's worth looking into, but generally we think that the issue is a system that's still healing and not strong enough yet for what you're demanding. And so persistent pain at that stage is usually more about weakness and muscle and joint irritation rather than failure of surgery. The careful patient just does better. That's not some soft observation. That's what I've seen play out across thousands of patients in years of follow up. And sticking to a structured, staged rehab program is one of the strongest predictors of a good long term outcome. And it's not something I understood as clearly early in my practice as I do now. If this is useful, please subscribe before you keep watching. I'm building a series specifically for people dealing with hip pain and surgery, and each video is built around what actually matters in clinical practice. Subscribe so you don't miss the next one. Point number 3. Are you just doing too much too soon? Here are a few questions worth sitting with honestly. Are you adding movements or activities because you feel okay, not because your care team cleared you to do so? Has your hip flared and settled more than once in the past few weeks and you just keep pushing forward each time it calmed down? Are you doing a generic hip exercise program or one specifically designed around your surgical findings and where you are at right now with your recovery? When your hip feels worse after something, do you stop that thing or do you tweak it slightly and just keep going, assuming it's going to get better on its own? If you answered yes to the first two or no to the third, you're in the most common pattern I see in patients who plateau or backslide. Now, it doesn't mean you necessarily caused lasting damage. It just means that the hip is still talking to you and the message is back off, let's rebuild more carefully. This is fixable, but it requires being honest about what your hip's telling you and not filtering it through what you want to hear. Point number 4. What happened when I ignored my own advice? So I want to tell you something. I don't say it enough. I've had hip arthroscopy. I've had this surgery. And I went into that recovery knowing exactly what the right approach was. I tell patients every single week, protect the repair, let the tissue heal. Don't rush the timeline. Protect your hip. I've said those words thousands of times. Then I had the surgery. I started feeling better faster than I expected. I literally had no pain than I had a surgery. But then I did exactly what I tell every patient not to do. I pushed. I tested limits. I told myself I was just staying active, that somehow I'm above the biology. But then I had a setback. I felt a pop or two. The hip flared back hard. I went back to work too soon. My progress slowed to a crawl, and I had to back way off and rebuild from a way more conservative baseline. Before the hip surgery, I'd also gone through a lumbar discectomy several years back. That recovery, where I was structured and patient, went almost perfectly. I knew what a good recovery looked like. Then I went through the hip, armed with all that knowledge, and I still screwed it up. The thing I need you to understand is that the pull to push isn't a character flaw. It's just a natural response to feeling better. And feeling better often feels like permission to do more. But it's not. The tissue is still maturing. The system is still fragile. And your body doesn't send you a courtesy text before the setback. It just happens. And so sitting with that setback as a patient, not as a surgeon, changed how I talk about this recovery because I finally understood what it's actually like to feel and know the right thing and still not do it. And it just made me way more direct with patients about why the structure has to be built into the recovery plan up front, not left to willpower in the moment. You just can't outwork biology, and that's the most important thing I now know about hip arthroscopy recovery, and I learned it the hard way. Point number 5, start here before your next appointment. There is a pattern in a patient who does well. The factor I have the most control over and the one that separates great outcomes from frustrating ones more than anything else is what happens in rehab over the 12 to 24 weeks after surgery. Here's what that looks like in patients who recover well. Number 1, they listen to their doctor and their therapist. Then they get stronger gradually with consistent hip and core work that builds over months, not weeks. They stop doing the specific things that keep the hip irritated, even when those things feel manageable in the moment. They stay consistent with the basics. They sleep well, they manage their weight, they eat healthy, they do simple routines without trying to optimize every single thing at once. Then they reset their timeline to match their biology, not the calendar. You don't have to wait for your next appointment to start doing this better. And here's where to begin. Write down the 3 movements or activities that consistently make your hip feel worse. Bring that list to your next PT session or appointment. Being specific about what aggravates the hip gives your care team real information that they can actually use to adjust your program. Then look at your care and exercise program and ask whether each exercise was chosen based on your specific surgical findings and where you're at, or whether it's a cookie cutter hip protocol. If you don't know, ask at your next session, and the answer matters way more than most patients realize. So if you're past the 6-week mark, or even the 3-month mark, and still having symptoms, stop assuming something's structurally wrong and start asking whether your hip's simply not strong enough yet for what you're demanding. That reframe changes everything you do next. If you've had more than one cortisone shot injection since surgery, ask your surgeon whether the goal of that next one is to identify a cause or to just mask the pain. Because repeat injections without a clear plan can also delay the actual work of fixing the problem. The patients who do best aren't always the most athletic or the most motivated. They're the ones who stay consistent, ask the right questions, have the right expectations, and don't let a setback become a reason to either push harder or to give up entirely. So, to conclude, recovery from hip arthroscopy is demanding. It takes a little longer than most people expect. It's way more sensitive to what you do in rehab than to how clean the surgical repair looked on the table. The process works when it's followed correctly, but it demands patience, structure, and honesty about what your hip is telling you, especially in the early weeks when you start feeling better and everything in you screams to just move faster. You cannot work biology. I learned that as a surgeon, and I learned that again as a patient. And the timeline is not a suggestion. And giving the repair the time it actually needs isn't giving up either. It's how you get back to full function and stay there that matters the most. Before you close this video, go watch the first video in this series, the one that covers something I see rec outcomes even before surgery happens, the gap between what an MRI shows and what's actually generating your pain, and why imaging alone isn't enough to make a smart treatment call, and the diagnostic step that actually confirms whether surgery is the right next step or the ultimate solution. That video is linked right here. Watch it before your next appointment. It'll change the questions you ask.